Here at Ashford and St Peter's hospitals, we pride ourselves on delivering compassionate, high-quality care for all of our patients. As professional nurses and midwives, we all work to and follow our Nursing and Midwifery Council Code of Conduct, revalidating to maintain our registration. Revalidating demonstrates that we practice safely, supporting the principles of the code by prioritizing people, practicing effectively, preserving safety, and promoting trust in ourselves and our colleagues as professionals. From April 2016, you and I, along with all nurses and midwives on the NMC register, will be expected to evidence their competency to practice. This is not new. You will all have heard of post-registration education and practice and have completed a declaration every 3 years. But from this April, a new system of revalidation is being introduced to improve the process. There will be new key revalidation requirements in addition to the previous PrEP requirements, which enable us to demonstrate safe, caring, and up-to-date practice. Specifically, as registered professionals, we will need to complete 450 evidenced practice hours or 900 hours if you are revalidating a dual registration, 35 hours of continuing professional practice relevant to your scope of practice, and 20 of these hours need to be participatory, which means some form of discussion, either virtual or face-to-face, a declaration of health and character, and finally, evidence of professional indemnity. Additionally, with the new system, we will also need to provide 5 pieces of practice-related feedback from a variety of sources, 5 written reflections related to your practice, and confirmation from a third party that all the requirements for revalidation have been met. Here at Ashford and St Peter's hospitals, we are committed to supporting you through this new process. We have a revalidation project lead nurse, Jo Finch, who will provide specific support for nurses and midwives due to revalidate in 2016. Jo will be communicating weekly about revalidation through Aspire and on our NMC Revalidation pages on TrustNet to explain all of the requirements in more detail. So, what do you do next? I would urge you to join me in registering online with the NMC, where you will be able to confirm your revalidation due date. You will then be able to organise your evidence for revalidation. To help with this, the Trust will be providing all registrants with their own personal online portfolio. This will enable you to collect and store all of the information required in one safe, secure place, which will make revalidating easier and smooth the process. To recap, the new system of revalidation commences in April 2016, and all nurses and midwives now have extra requirements to complete every 3 years. The detail of all of these can be found on TrustNet and the NMC website. I would like to know exactly where every registered nurse and midwife in the Trust is in terms of your readiness for revalidation. Therefore, in confidence, can you please email me and let me know whether you are 1. Ready and will revalidate, 2. Need more help and support to revalidate, or 3. This, for me, is the right time to leave the profession. So please, do not worry. Revalidation is an excellent opportunity for us to provide reassurance to the public and our patients that we continue to learn and keep up to date, helping us to provide safe, effective, and compassionate care for all.